Hi, Mrs. Zislo. It's Tiffany, and this is my anatomy project. So I mostly crocheted all of the organs and the vessels. The base of my project are three separate wooden slabs that are attached with each other through magnetic tape, and they each have wooden dowels that have been screwed into the base. And then the organs themselves are attached to the wooden dowels with Velcro. That's the construction of my project. And before I get into describing the vasculature, of the abdomen, I'll go ahead and briefly describe the function of each organ. So the first layer of my project includes the liver, the stomach, and the intestine. Our liver is one of our most essential organs for life, and it's responsible for over 500 separate functions, such as bile and lymph formation, metabolism of proteins, fats, and carbs, and it can also act as a blood reservoir. The stomach is where our food is broken down so that way our intestines can further digest it to absorb nutrients and form feces out of the waste products. In the second layer, I have the heart, pancreas, and spleen. Now, of course, the heart isn't an abdomen organ, but we know that that's the organ that pumps blood throughout our body using the circulatory system. Our pancreas creates enzymes such as amylase and lipase to further help digestion, and it also produces hormones such as insulin and glucagon to regulate our blood sugar levels. And the spleen is responsible for filtering our blood. And in our final layer, we have the kidneys and the aorta and IVC. The kidneys, of course, are what produces urine and controls our blood pressure. Then our great vessels are what actually transports our blood to and from the heart. So now that we've gone over the basic functions of our organs, I can go ahead and start going into the vasculature. So to begin with, we have our aorta, which originates from our left ventricle of the heart. It courses inferior through our body until it bifurcates into the right and left common iliac arteries. The first branch of the aorta is the celiac trunk or the celiac axis, which then divides into the left gastric, the splenic, and the hepatic arteries. So we have the left gastric artery, which courses anteriorly into the left of the body into the stomach. The splenic artery courses horizontally from the celiac axis, then runs along the superior border of the pancreas, subsequently also feeding it before ending at the splenic hilum. And we have the hepatic artery, which courses anteriorly into the right of the body, entering the porta hepatis to the left of the common bile duct and anterior to the portal vein. And obviously, the veins don't actually sit like that ever. I'm just putting it out of the way so we can focus on the aorta. Just thought I'd put that as a side comment. The second branch of the aorta is the SMA, or the superior mesenteric artery, which is distal to the celiac axis, and the SMA runs inferiorly through our body to the intestines, and it is posterior to the pancreas body and anterior to the uncinate process. Then we have our renal arteries, which originate from the lateral aspect of the aorta, going to the left and right kidneys, respectively, with our right renal artery being longer because it is on our left side of the body and it courses posterior to the IVC. But in reality, it's actually not as long as I have it represented in this model, and that's mainly because I just miscalculated and misplaced the kidneys. But normally it is longer than left, it's just not that long. But and then finally we have the bifurcation, which, like I said earlier, it becomes our left and right common iliac arteries. Now that we finished discussing the aorta, we can go ahead and get started with the IVC, which originates at the junction of the left and right common iliac veins. The IVC courses superiorly through our body until it terminates at the right atrium of the heart. So first we have the renal veins entering the lateral aspect of the IVC, with the left renal vein being longer than the right renal vein because the IVC is on the right side of our body. The left renal vein courses anterior to the aorta, but posterior to the SMA, which ends up creating the nutcracker phenomenon, which describes how the left renal vein can be smushed between the two. And we also have the left, middle, and right hepatic veins draining directly into the superior aspect of the IVC. And lastly, we have the portal venous system, which is completely separate from the IVC because this system actually brings nutrient-rich blood to the liver, and it consists of the splenic vein, the superior mesenteric vein, or SMV, as well as the inferior mesenteric vein, but that's not represented in my model. but the splenic vein runs posterior to the pancreas body, where it joins at the portal confluence with the S and V at the neck of the pancreas. There they become the portal vein, which enters into the portal hepatis, posterior to the hepatic artery and the common bile duct. And that was my anatomy project. During the course of making this entire thing, it really just helped me piece together all the knowledge that I've gained so far, because I feel like my head was kind of like the book, like how I learned it is how I memorized it. So I would just memorize everything with the liver and then the kidneys and the pancreas, but they're all separate in my head. And that was especially clear when I was actually making the kidneys. In particular, I was having issues with because it just didn't click in my head that the liver and the kidneys, they're kind of similar, not like fully the same size. But I mean, when you look at the measurements, like the length measured for the liver is about a 13 to 15, and the kidneys is 10 to 12 centimeters. Like that's not super far apart in size. But I guess for me, like because I had sectioned them off, I just remember like the liver is one of our largest organs. So I was thinking like the kidney should or the liver should be really large, but the kidney shouldn't be like similar size, even though they are. And it's funny because when I'm scanning, like I recognize that and I understand that because when you see the kidneys in Sag next to the liver, like it's not like a teeny tiny little piece. Like it's relatively similar, not similar size, but like, they're comparable. And yeah, like it really just took me doing this project to really have that click in because like I knew them separately. I just couldn't for some reason like put them together. So it was really nice doing this project because then I could see everything, especially because I had to plan it out. But yeah, so that was my project. I really did enjoy making this because crocheting is a pastime of mine, so it was nice to have an excuse to like bring out my needles, or not my needles, but my hooks and just relax for a bit because this program is so special. But yes, this is my project. I hope you enjoyed and thank you for watching.